everyone, it's Leonis Quinn coming to you on behalf of Bree, the Anthony J. Chapman Asthma Foundation. We are an asthma foundation that deals with asthma education. If you watched our last video, you understand our purpose and our reason for forming this foundation. It strictly revolves around honoring my son Anthony, who had a fatal asthma attack a few years ago. So this foundation was formed to honor him and to also help other families and communities to understand asthma and hopefully to help you live a better life. So today we're going to talk about what exactly does it mean to have asthma. What does that mean? How does it look? Asthma is a Greek word that means shortness of breath, gasping for air. There are approximately, this is according to a 2016 study that I was reading, there are 25 million Americans that are diagnosed with asthma, more women than men, 15 million women, 10 million men, and then there were 6.2 million children that have been diagnosed in the year of 2016. Well, now you know it's the year 2020, so of course there have been more cases being diagnosed and unfortunately more deaths. In that study, there were 10 deaths per 1 million, which came out to be like 3,500 deaths per year. And during this time, there has been a significant increase in asthma deaths. African Americans, our culture, have the highest rate of asthma. Our kids have the highest rate. Our women have the highest rate, and they also have the highest number of deaths, according to the study. Also, there were different studies about what causes asthma. What exactly causes this disease? And there were a few suggestions that were mentioned. One was genetics, hereditary. Like our family, my family, I have asthma. My nieces and nephews have asthma. My brother has asthma. So it kind of runs deep within our family. But then you may not have asthma through that mode. You may have gotten asthma environmentally through tobacco smoke, smog, ragweed, dust mites, mice, roaches. Those are also things that could help you be diagnosed with asthma. And then on the other hand, there's occupational asthma. This asthma is diagnosed through your job. And just say, for instance, for example, you work in a bakery. And of course, we know bakers use lots of flour. The flour particles could get down in your lungs, could cause the asthma symptoms. And before you know it, you're going back and forth to the doctor trying to figure out what it is. And you finally are being diagnosed with occupational asthma. It happens. It happens all the time. And that kind of negates the fact that asthma is a childhood disease. As we know, that is not true. Last time, if you remember, I talked about how my mom was 76 years old when she first developed her first asthma attack. So you can have adult onset asthma as well. Like I said, asthma is not easy to diagnose, especially for our children. When kids are diagnosed with asthma, it takes a little bit more time and effort for the physician to actually say your child has asthma. If you have your child in a daycare, and you know how daycares go, one kid gets the stuffy nose, runny nose, the cough and sneezing, the other kid gets it. So when you have these kind of environments where varying degrees of illnesses can be passed around, it's kind of hard to do. And one of the avenues or the things that they do to test to see if you have asthma is called spirometry. Spirometry is a test that's designed to see how much volume of air is within your lungs. How does your lungs behave with this volume of air? Are you able to blow all the air out of your lungs? Are you able to take in a deep breath? Those kind of things. So when you're able to do spirometry, it kind of helps the diagnosis along. But for our babies who are unable to do this, especially I would say from 8 years and younger, they will probably have a hard time doing spirometry because it takes a huge effort with strong lung muscles to breathe out the volume of air that's in your lungs. It would take a lot. So it would take probably more for diagnosis for asthma to come for children than it would be for an adult. All right, so we're going to talk about what happens in our lungs when we're having an asthma attack. I am a visual learner. If you are like me, pictures, diagrams, all kind of images help me to understand what I'm trying to learn much better. So with that, I do have a couple things that may help you to understand what it is when you're having an asthma attack. So I have this diagram here. I'll hold it so you all can see it. It is a diagram of a lung. The lung, as you can see, looks like a tree trunk. That's what I call it. But it is a lung. And when we are breathing normally in and out, in through your nose, out through your mouth, when you breathe in, your air goes to the trachea, which is here, and the trachea carries it through the bronchus, down through bronchioles, where the bronchioles branches off to other branches of the lung, and eventually it gets down to the alveoli. The alveoli are tiny sacs that kind of gets the air moving into the bloodstream. It takes the good air in, it takes the bad air out. The bad air is carbon monoxide. So we don't want to have a buildup of that in your lungs. So when you're breathing really well, your lungs are functioning great. But when you're having an asthma attack, the asthma affects this part of your lungs. This part here, the bronchioles. The muscles that surround this part of your lungs squeeze tight, and fluid forms in your lungs. It begins to fill up. And so therefore, when you're having an asthma attack, with the squeezing, the fluid, there's no way, or you have a difficult time getting air to the alveoli where it belongs to circulate in the bloodstream, because you got all this tightness up here. I'll show you, hopefully you can understand what I'm talking about a little bit better. This is my diagram of a lung. And as you can see, the opening is quite clear. You're breathing well. It's great. All of a sudden, as you can see, your lungs begin to fill up with mucus. When you get the mucus in your lungs, it makes it very difficult to get the air in past the bronchus, past the bronchioles, and to the alveoli, because you have all this buildup in there. And the more it goes down into your lungs, the airways become more and more smaller until eventually it's very difficult. You had a very difficult time breathing. And when you get to that point, you may see people in a tripod position where they're trying to breathe better, and you see them hunched over. When you see people like that hunched over, the diaphragm in your belly is rising up, which kind of helps you to breathe better. But you are working very hard to get air through all of this down to the alveoli, which, like I said, remember, alveoli is the tiny sacs here where the air exchange is good and it gets the bad stuff out and the good stuff goes in. And this is also a diagram of the great lungs and a diagram of the lungs that are surrounded with muscle tightening of the airways. I hope you all can understand. I hope that was helpful for you. With this note, I hope you understand the significance of keeping your albuterol inhaler with you at all times, even if you're feeling great. Keep your inhaler with you in your pocket, your backpack. For me, I have one in my bag for work, my bedside, I go in my purse. I have an inhaler wherever I go, even if I'm feeling great, because you never know. The time comes when you may come in contact with a trigger or irritant that may set your asthma off. Even though it may not prevent you from getting a full-blown asthma attack, it certainly will help. It certainly will help. And I don't want us to get into the mindset of just because you have mild asthma that you cannot have a severe asthma attack, because you can. There are different stages of asthma. I can mention mild intermittent asthma is the mildest asthma you can have. You have asthma maybe one day a week. You may have a cough. You may have to use your inhaler one day a week. But then there's the other side that has persistent asthma. Persistent asthma has the intermediate, the moderate, and the severe. So when you get to the persistent side of the asthma, really, you're probably on a controller medication as well as the rescue inhaler. So try to keep in mind, if you have good asthma, try to keep it there, but also remember that just because you have mild intermittent asthma where you hardly have an attack, you can go from that to having a severe attack where you end up in the hospital. I hope this information was helpful to someone. You can pass it on to your family and friends who you may know may have asthma. The phone number will be posted again. You can chime in your questions. You can call the line. We'll be answering the phones. We have a Facebook page, the website. Hopefully will be helpful to you. And we will be doing the videos quite frequently. And the next video will be coming out hopefully in a couple weeks. It will be more good information for you to live by. So until that time, stay safe and stay well.